Let's learn about wound documentation. When there are active wounds present in the system, the wound manager will be teal instead of blue, indicating you'll need to document a wound assessment. Once inside the wound manager, you will see the last picture taken. Click on the current photograph to change the image at any time. Wound care order and treatment performed is read-only. You won't need to do anything since this text will automatically flow to the visit PDF and the wound flow sheet when the documentation is complete. Wound measurement is the first data point. Selecting yes will activate the wound score since length and width are required to calculate the square area of the wound. The wound score is generated to indicate if a wound is healing, declining, or stagnant. There is also a tooltip to guide you on how to accurately measure wounds, which should occur at least once a week. To help with compliance, you'll see the last date the wound was measured and the wound's dimensions. Next is the tissue type. If closed or epithelial tissue is selected, you don't need to do anything else. Additionally, that prevents questions on things like tunneling and undermining from appearing in the assessment questions that follow. If you select granulation tissue or any other response, you will be prompted to enter the percentage of tissue. You will also need to select the highest level of tissue damage. As an example, if there's both granulation and slough, select slough and then document the percent of granulation and slough tissue. As a reminder, stage 2 pressure ulcers heal by epithelialization and do not granulate. For the appearance of the skin surrounding the wound, if abnormal is selected, you'll see more choices to further describe the skin characteristics. If you select macerated, you'll be required to enter partial or parawound. Wound edge can be normal or abnormal with additional selections required. For wound drainage, a yes response requires that you document the type of drainage and the amount. When selecting yes to wound odor, select the intensity of the smell. If the patient has tunneling or undermining, you can indicate the depth and position of the tissue damage for one or more areas by selecting the plus sign. Select the X to delete the option. When wound pain is present, it's documented with a pain scale for consistency. If a patient has signs and symptoms of an infection, you'll see multiple options to completely document the interventions performed to prevent further deterioration of the wound status. In the response to treatment section, you can document how the patient tolerated the procedure, the caregiver's ability to perform wound care, and if the patient engaged in non-adherent activities with the potential to impact wound healing. On subsequent visits, below wound pain, you'll see a prompt for change in wound type. Restaging the wound is documented here. See Managing Wounds on Subsequent Visits via the Watch icon or the Learn More icon for further instruction. Also, you can select Load Previous Documentation when inside the Wound Manager. However, the items that inform the wound score are not loaded from the previous documentation. See the Learn More icon for further information on the wound score, including which assessment questions are calculated. You can select Save at any time to save the data and stay in the Wound Manager. However, to exit the Wound Manager, you have two options. Save and Exit will allow you to save the data and then exit the Wound Manager. You will receive a warning alerting you to complete your documentation on the day of the visit to prevent limited functionality due to late documentation when subsequent visits are started. Select Complete when you've entered all the required information. If all of the questions have been answered and the wound has been documented, the wound status will be green and you'll be able to exit and complete the Wound Manager. However, our QA Assistant feature validates skipped questions and undocumented wounds. These are highlighted in red in the wound list. Click on the wound to navigate to the page where the infraction is outlined in red. Lastly, if you have several wounds and some do not require care to be performed on the current visit, select Care Not Performed and a reason from the drop-down list, so the QA Assistant will validate the wound.